am Gabriela Ortiz.
I'm Rosanda Wood.
And I am Erica Platas, and today we are going to be giving our presentation over what it means to be a physician assistant. So what is it? A physician assistant, or a PA, is a licensed medical professional who holds an advanced degree and is able to provide direct patient care. They diagnose and treat patients of all ages and work across many specialties. Meet Victoria Sange. She is a licensed board-certified PA at Parameter Orthopedics in Atlanta, Georgia. She received her master's from South University in Savannah, Georgia, and attended the University of Texas at San Antonio for her BS in kinesiology. We asked Miss Victoria Sange what led her to be a PA, and her answer was, after a mission trip to Nicaragua, Victoria Sange found a sense of accomplishment by helping restore the health of many people. From then on, she worked hard to become lead PA and a surgical first assistant.
One question that we asked her was why she picked her specialty as an orthopedic surgeon. And she said it was very important to her, so it was no surprise when she dismissed the low-paying offer in neurology and opted to practice in orthopedics, which would allow her to help in the surgical room. Another question we asked her was what was her day daily as a PA and at Parameter Orthopedics, and she said that she spends her Wednesday and Thursday mornings in the surgical room, arriving at the hospital at 6:30 a.m. and rolls back at 7 a.m. Other days are spent in clinics from 8 a.m. to 5 p.m. Working in emergency medicine means you often aren't expected to stay all 12 hours. However, primary care differs in what they are expected to remain present for the duration of the 12 hours. The PA is also expected to be present while the doctor is in the clinic, and Victoria Sange may see up to 14 to 22 patients in a single day. Another question we asked her was what were some challenges she faces as a PA, and she stated that although PA may be exciting, she has ran into her fair share of issues. For example, conflict may arise when the PA doesn't agree with the doctor's treatment plan. With their license on the line under the MD's license, the PA has no choice but to listen to their boss. It can get tricky when the goal is to do what's right.
We asked her what some of the benefits of being a PA are, and aside from the hard work and long days, being a PA has its perks. Victoria Sange enjoys a nice balance of surgery, clinic hours, and leisure time. Moving fields is not as difficult, which helps the job fresh and exciting. However, her specialty also allows her to work with adults as opposed to children, not to mention the teamwork that goes into play can make a big difference. She did share some unique and shocking stories that she's seen over the years. While preparing to be a PA didn't bring any surprises, it didn't fail to bring unique cases. During Sage's career, she had come across an exciting case dealing with a boy being curious and exploring with an adult toy, but was able to resolve the issue professionally. It was clear you can see more on the 5 weeks of rotation or shadowing. However, the most interesting aspect comes in the form of many different circumstances. We asked her what the average income for a PA is, and it varies depending on the years of experience, field, and the place of work. For example, New York pays more than Texas, and an orthopedic surgeon gets 90 to 105K.
All right, so one of the great things we were able to talk about with Victoria was the amount of experience that she thinks a pre-PA student should be looking at having before actually starting the application process for medical school itself. Now, one of the great things that she mentioned about UTSA is the fact that we have so many organizations and so many clubs that are related to volunteering and shadowing experiences that come in the medical field. Another great way that she taught us about was certify yourself as an EMT or certify yourself as an MA. That really puts a highlight on your resume, and she thinks that's a great way to get into PA school on the first try. We were actually able to ask Victoria a couple extra questions at the end of our interview, and Erica asked her, I think, one of the best questions of the interview, and that was, what would you tell young Victoria? What advice would you give her? And one of the biggest things that she mentioned is start trying to find your passion now. You want to be able to have those skills and the mindset of what you want to do before you even get into school, because it's going to lead you in the right direction. Last but not least, we wanted to say thank you so much for listening to our presentation. We had a wonderful time interviewing Victoria, and if y'all have any questions, feel free to let us know. Thank you.